How do modern imaging techniques diagnose lymphoma precisely? Imagine trying to find a tiny needle in a large haystack. That's similar to how doctors locate lymphoma in the body. Modern imaging techniques are like high-powered magnifying glasses that help doctors see exactly where the disease is and how far it has spread. These tools combine different types of images to give a complete picture. The main methods used are computed tomography scans, magnetic resonance imaging, and positron emission tomography combined with computed tomography, often called PET-CORT scans. Each plays a unique role in making the diagnosis accurate and detailed. Computed tomography scans use X-rays taken from many angles to produce detailed cross-sectional images of the body. They help identify enlarged lymph nodes and check if organs are involved. Sometimes, a special dye called contrast is used to make abnormal areas stand out more clearly. While CORT scans are excellent at showing the shape and size of tissues, they can't always tell if the lymph nodes are actively fighting lymphoma or just scar tissue left over from past infections or treatments. Magnetic resonance imaging, or MRI, uses magnets and radio waves instead of X-rays. This means no radiation exposure. MRI is especially helpful for examining the nervous system, bones, brain, and spinal cord, where lymphoma can sometimes spread. It provides superior soft tissue contrast, making it easier to see lymphoma in these delicate areas. This makes MRI a valuable tool when doctors need to look closely at parts of the body that are difficult to evaluate with CORT. The most advanced and widely used technique is PET-CORT. This combines metabolic information from PET scans with detailed anatomical images from CORT. Patients are injected with a small amount of radioactive sugar called fluorodeoxyglucose. Active lymphoma cells consume more sugar because they are highly metabolically active. The PET scan detects the radiation emitted by the sugar, highlighting areas where the disease is active. The CORT scan then provides precise location details. This combination allows doctors to see not only where lymphoma is present but also how active it is, which is crucial for staging and treatment planning. PET-CORT is considered the gold standard for diagnosing, staging, and monitoring lymphoma. It is more sensitive and specific than CORT alone, meaning it can detect smaller or more subtle areas of disease. Studies show that PET-CORT can identify lymph node involvement with sensitivity up to 94% and perfect specificity in some cases. It also helps distinguish lymphoma from other conditions that might look similar on imaging. This accuracy can lead to better decisions about how to treat each patient, whether it's starting therapy or adjusting it based on how the disease responds. Recently, new technologies are enhancing these imaging methods further. Radiomics and machine learning analyze hundreds of imaging features to help differentiate lymphoma subtypes and predict how well a patient might respond to treatment. These advances are still being studied but hold promise for even more precise diagnosis and personalized care in the future. In summary, modern imaging techniques diagnose lymphoma with high accuracy by combining detailed pictures of the body's structure with information about how active the disease is. This multimodal approach helps doctors find lymphoma early, determine its extent, and monitor how well treatments are working. Always remember, these tools are part of a comprehensive diagnosis that should be guided by healthcare professionals. If you or someone you know is facing lymphoma, consulting a medical team experienced in these advanced imaging methods is essential for the best possible care.